Participating in the ITP for SRHR with Lund University has built my capacity so much in sexual reproductive health and rights.
I have actually learned a lot. I'm still learning a lot, and already the knowledge I have, we're actually putting it into practice.
It has built my capacity as a health worker to provide SRHR services to adolescents.
We are a team of different people coming from different sectors. We have health workers, civil society, Ministry of Health, local government. This multi-sectoral approach enabled us to approach our work from different angles, working towards increasing accessibility and utilization of sexual reproductive health rights. We were able to design a change project that looked at increasing utilization of SRHR and services among young people.
We are thinking of so many innovative ways of how we can improve our sexual reproductive health service delivery in the country. Sexual reproductive health is actually a global issue that should be handled at a multi-sectoral with a multi-sectoral kind of approach.
Through the ITP, I was able to realize that we have so many resources that we can use. Resources include the health workers, our organizations, plans that the districts and the local government have, the community structures that are available. So we're able to put together these different resources to implement a worthwhile project.
I also realized that sexual reproductive health programming is actually affected by a number of factors, including the social factors in the different countries we come from, because some of our colleagues that shared with us, if I made quotes from South Sudan, there are social cultural factors that actually affect the programming of sexual reproductive health in their country. I was able to understand that the economics of a country, the resources the country has, have effects on the service delivery of sexual reproductive health services.
We have established a network, a community network of youth to promote peer learning, whereby the youth are reaching out to each other, to one another, to access reproductive health services at their health centers.
We get the young people and they help in educating their peers about sexual and reproductive health, then continuous mentoring of the teachers to improve their knowledge on SRHR services.
When we go down to these school health clubs, the peer-to-peer learning has actually helped youth so much for them to have access to information about SRH, for them to learn issues about SRH because they're actually learning from within themselves. And in a way, some of these youth that were actually left behind are actually now utilizing sexual reproductive health services at the facilities near them.
There are more youth that are coming to test for HIV and AIDS, seeking out treatment for sexually transmitted infections, coming for antenatal care and postnatal care, and this wasn't the case before.
Before the change project, we had very low numbers. Like in a month, we would get like 5 people. So like with this change project, we managed to start collecting data because we have our registers in the adolescent clinic. We can go up to 100 adolescents seeking services in our adolescent clinic. We can see these people have started coming up and they are taking it normal. Like when they get any complications about these issues of the reproductive health, they are more free to come at the health facility and seek care.
Having different sectors coming together enhanced our efforts to increase utilization of these services. For instance, for us from the CSOs, we were able to work with the communities to mobilize, work with the schools to mobilize the school children to come to the health facilities to access these services. The health workers were able to provide user-friendly, adolescent-friendly services because they got training through the ITP. The team member that we have working at the district was able to incorporate sustainability components of this program.
Well, if I had not participated in the ITP SRH program, I think I would have missed a lot of knowledge with sexual reproductive health programming.
I wouldn't have known like the adolescents are to be taken as a priority.
We were able to visit the hospitals, to appreciate the healthcare of Sweden. We visited different projects for HIV and AIDS prevention. We visited centers where youth-friendly services for SRHR were given. It's a joy to document the change that is being experienced by the participants, the adolescents and the young people that are utilizing the sexual reproductive health services as a result of this change project.